Our mission is to improve life of patient and family impacted by heart failure.
Through excellent clinical care, state-of-the-art technology, education, and innovative research.
Our approach to care is in the partnership with patients, families, referring physicians, and the community.
We strive to provide accessible, comprehensive, quality-driven care in a compassionate environment.
When providing care to our patients, we aim to optimize heart function, minimize symptoms, improve quality of life, reduce hospitalizations, increase longevity, and empower self-management skills and make patients healthier.
For patients with a more severe form of heart failure, offer hope through advanced therapies such as heart transplantation and ventricular assist device support for an appropriate candidate.
As one of the premier academic heart failure programs in the nation,
we are committed to advancing the field of heart failure through research, serving as an education base for physicians and other health professionals, as well as acting as a referral center for patients throughout the Southeast area.
A mission statement is a purpose or a reason that an organization or a program exists. I'm very proud of our staff because they developed a mission statement together. They were very passionate about having an expanded mission statement that included not only just a statement about their purpose, but one that also included specific goals of care, their approach to care, and some of the commitments to patients, referring physicians, and to the community. As you hear their mission statement, you will hear their underlying beliefs and values, which translates into their performance and helps them to be the outstanding staff that they are.
I think leadership plays a very important role. One of the things that I notice in the Center for Heart Failure is the physician leadership that group has, and it is a tremendous leadership group. Dr. Smith is the medical director, and he is very involved with all parts of the Center for Heart Failure Therapy and their staff. The Center for Heart Failure Therapy moved over from the hospital to the clinic in 2005, and Dr. Smith, even at that time, was very involved in the move, making sure that all the staff would be staying together and that it would work well for his department. I noticed immediately in meetings that when he had staff meetings, he involved everybody. He involved the secretaries, the nurses, the research group, and everybody felt like they were part of that team.
I look at our leadership as setting the direction and then getting people engaged to sort of follow in that direction. I really look at the leadership as moving people horizontally rather than a top-down leadership telling people what to do.
Leadership helps make the team what it can be through their communications with each other and with the team members. If the team members don't know what our hopes and goals for the organization are, then we're not going to get anywhere. So that's why it's important that we are very succinct in what we know we can achieve and what we hope we can achieve.
There is no organization without teamwork. I believe in the systems theory in which every system has many parts, and every part is important to the whole. And a team is like a system. It has many individuals which are the parts of the team, and each individual has a role that they play in the team, and every role is important to the team, and we treat that every individual and their role as such. If we work in synergy, collectively, we have an outstanding team.
We're really only as strong as our weakest link, and that is that for what the patient experiences, if they have trouble getting through on a phone line, if the phone's not answered, or if information is not communicated between our staff in an appropriate manner, that's going to affect the patient. So, you know, our staff recognizes that, you know, our patients have difficult problems, that they're needy, they often travel from long distances, and we have to do everything we can, all of us, to make that happen. So part of the teamwork concept is really getting every member of the team to realize that they have to carry their load and their responsibility to move the team forward, and that if they're not doing that, if somebody's not doing their job at the highest level, that really impacts how the team performs, and ultimately that impacts what happens to the patient. Once the staff realizes that their job is very important to the patient and to our mission, and that working at a place that is making changes and having an impact in healthcare, a place such as Emory, that's a very important thing. Once they realize that, they become much more engaged, and I think they enjoy their work more.
Teamwork has changed in the Center for Heart Failure Therapy over the last couple of years. We don't act as splinters now, we act as a team, whereas if we were short-staffed on this campus, we didn't think about asking the other campus to help, and vice versa. So now there's comfort in knowing that we can reach out to the other sites and not just be independent.